Hello friends, in this video I am going to discuss about labor. Let's start with labor in obstetrics. Let's see the normal divisions of labor. The first three stages regarding the labor, and stage 4 is the observation after delivery. So stage 1 is the onset of contraction to the full dilatation of cervix, and stage 2 is the full dilatation of cervix to the delivery of fetus, and stage 3 is the delivery of fetus to the delivery of placenta, and stage 4 after delivery of placenta 1 hour of observation period for postpartum hemorrhage. Now the first stage is divided into latent phase and active phase. So this is the cervical dilatation in centimeter, and this is the time in hour, and this graph is the Friedman's graph. So in first stage it is divided into latent phase and active phase. Latent phase is the phase in which the cervical dilatation is 3 cm or lesser. After 4 cm, the slope is rapidly progressing. So in latent phase, it can take 5 hours or 6 hours or even 10 hours. Latent phase is the phase with irregular contractions, not very strong, not very painful, and it is said to be around 3 to 4 hours or 5 to 6 hours. So in latent phase, the latent phase should never be more than 14 hours. In multigravida, and the latent phase should never be more than 20 hours in primigravida. After the latent phase, patient goes into the active phase of labor, consists of acceleration phase, phase of maximum slope, and deceleration phase. And after the deceleration phase, cervix is fully dilated. So from 4 centimeters to 8 centimeters of cervical dilatation, that is the strongest contractions of a patient. If a patient comes to you with 5 centimeters of cervical dilatation and she is only at 32 weeks age of gestation, don't you want to stop it? Yes, you want to stop it, but you cannot stop it. That is the preterm labor. So you can stop preterm labor only in the latent phase. You cannot stop if the cervical dilatation is 4 or after 4. You cannot stop it. You can stop the preterm labor only in the latent phase. So tocolytics are to be given. Tocolytics can be given, and it can act only in the latent phase of labor. Tocolytics are to be given when the cervical dilatation is less than or equal to 3 cm and gestational age should be less than or equal to 34 weeks. And why 34 weeks means this time lung will be matured. We need every woman should deliver at 37 to 42 weeks, and that is the normal term, and less than 37 weeks is the preterm labor. And what are the causes of preterm labor? Infections. Infectious causes are the most common, and in infections they can get UTI, asymptomatic bacteria, and chorioamnionitis. Chorioamnionitis is otherwise called PID in pregnancy. And there can be anatomic causes. Anatomic causes would be bicornuvate uterus, unicornuvate uterus, short cervix or oval distension, and short cervix is the cervix less than 2.5 cm, and oval distension may be due to twin pregnancy or polyhydramnios or large baby. You can predict preterm labor by the ultrasound. We will do 12th to 13th week scan, NTNB, nuchal transposency nasal bone scan, and we see the length of the cervix and shape of the cervix. And here, let me show you the nicely tightly closed cervix. It is the T shape. So this is the T shape, T shape is normal. It's tightly closed cervix. And this is the Y shape. Y shape is the beginning of the cervix to open up from inside. Then it will become V shape. And finally it becomes U shape. And U shape is the final sign that patient is about to deliver. Other than size, you can predict preterm labor by seeing these shapes of the cervix. So U shape is the final sign. You can predict preterm labor in the vaginal secretion, and FFN is the fetal fibronectin, and this fetal fibronectin is the glue which sticks the amniotic sac here. It sticks the amniotic sac. FFN is seen between the uterine wall and the sac. It sticks between here, and this fetal fibronectin is seen in the gestational age of less than 22 weeks and after 37 weeks. If you see this FFN between 22 and 37 weeks, it should be diagnosis of preterm labor or rupture of membrane. When you are diagnosed with preterm labor, and what are the tocolytics be given? And these are the tocolytics: beta agonist like salbutamol, terbutaline, rituximab, isoxsuprine, and you can give calcium channel blockers, nifedipine, and calcium antagonist, that is magnesium sulfate. And calcium channel blocker nifedipine is the drug of choice. But you can give magnesium sulfate. This is the neuroprotective one, and it can be asked in the question, what is the neuroprotective? That is magnesium sulfate. And what is the side effect or risk in this magnesium sulfate is hypotonia. Baby may have some respiratory distress, so there is risk of hypotonia. Magnesium sulfate protects the baby from any cerebral palsy, and this nifedipine is the drug of choice for preterm labor. Beta agonist also be given, but salbutamol has the risk of it increases the pulse rate, and it causes tachycardia, and there is risk of pulmonary edema. You can give other drugs like indomethacin or progesterone. Indomethacin is the prostaglandin synthetase inhibitors. Indomethacin is the good drug for preterm labor prevention, but you cannot give it beyond 32 weeks age of gestation because there is a risk of premature rupture of the ductus arteriosus. And progesterone is the safest drug. It known to cause relaxation of the uterine muscles, but it can only given like a prophylaxis. Maximum you can stop preterm labor within 7 days by giving such drugs so that lung maturity is achieved. So once you know the lung maturity is achieved, you can do the preterm labor. And how will you know the lung is matured? So lung maturity is said to be done if LS ratio is more than 2:1, and in the amniotic fluid, if you see this phosphatidylglycerol, it's a part of the component of the surfactant, you can say the lung is matured if you see this phosphatidylglycerol. And best would be the phosphatidylcholine. It is also the part of the surfactant. It is 70% of the surfactant produced from 24 weeks onwards from the type 2 alveolar pneumocytes. So what is the surfactant? Some fatty substance which is present on the lung, which makes the lung smooth And when the lung is expanding, so it will not collapse immediately. So it is a fatty substance. To reduce the tension on the alveoli, fat should be present, right? And the best type of fat is this phosphatidylcholine, and it is present ever since 24 weeks of gestation. And it will increase by 28 weeks, 32 weeks, and by 34 weeks, all the required fat is made. However, this phosphatidylcholine is 70% of the surfactant. It is produced from 24 weeks onwards until 34 weeks. But as a final indicator, phosphatidylglycerol starts to come into the amniotic fluid after 34 weeks. So if you see this phosphatidylglycerol, you can say the lung is matured. So phosphatidylglycerol is the final indicator of pulmonary maturity. So phosphatidylglycerol is the final indicator of lung maturity. And then how will you assess lung maturity? You will see phosphatidylglycerol in the amniotic fluid by doing the shake test or tap test. So phosphatidylglycerol is only seen in amniotic fluid. That's how we are going to assess the lung maturity, by doing the shake test and tap test. So both tests assess the lipids in amniotic fluid. So what are we going to do? We assess the lipids made by the body of the baby. You know, the skin of the baby is making lipids. Babies are born with that whitish thing, right? Vernix caseosa. When the baby is born, you can see the whitish thing in between flexible area in the neck, in the back, in the thigh. So that vernix caseosa is the fat totally pasted on the baby, on the body of the baby. That vernix caseosa prevents loss of temperature when the baby is born, so that he doesn't have a temperature shock. So that vernix caseosa is basically fat. It will come, so that fat will come in the amniotic fluid. Some of the fat will come in the amniotic fluid surrounding the baby. So what you gonna do is you tap the mother's abdomen, take out this amniotic fluid. You can take this amniotic fluid in a test tube. You add a saponifying agent that will convert the fat into soap. If the fat is converted into soap, there will be bubble formation. So if there is a bubble formation, fat is converted into soap, and that is the confirmation for lung is matured. How? Because the fat present on the baby's skin is the similar fat or made by the lung of the baby. So that's how you will know the lung is matured. You can also do Nile blue sulfate test. In this test, you will take the skin cells that will be present, little skin cells that will be present in the amniotic fluid. You will take that skin cells in the test tube. You will add the Nile blue agent, and it should be turned into orange color, and it is the confirmation for lung maturity. That's all, guys, and this is a rapid revision for labor, and I will continue to post videos for rapid revision for your FMGE exam this December 4. So keep watching and keep supporting, and thank you.